Hey everybody, Dr. Anthony Youn, America's Holistic Beauty Doc here. And today I'm going to be talking a little bit about tummy tucks, give you some tips on tummy tucks, as well as, I'm just going to bring this down a little bit, as well as we're going to take your questions, so feel free to ask questions and I'll do my best to answer them. What I'm going to start by doing is just give you some information on tummy tucks. If you follow me on Instagram, you saw that I did a big tummy tuck today. We took a lot of skin off of a patient, as well as did a good amount of liposuction on her. This is one of my most popular surgeries. Let me see if I can bring this down just a touch more. That's good. One of my most popular surgeries that I do. Gosh, I probably do at least one a week, if not more. And what I'd like to do today is maybe give you some tips on tummy tucks to help you with your decision making if this is something that you're thinking about doing. So a few things. There are lots of different tummy tucks out there. So if you are thinking about a tummy tuck, you may wonder, should I have a mini tummy tuck? Should I have a more traditional full tummy tuck? What about this specialty tummy tuck that this doctor in my town is advertising? First thing I want to let you know is be very careful. If it sounds too good to be true, it probably is. In my community, as well as others, there are non-plastic surgeons who advertise their own specialty tummy tucks, and I'll tell you right now, it's all BS. As plastic surgeons, as board-certified plastic surgeons, one thing that we pride ourselves in as a community is sharing with each other the latest advances in our specialty. Okay, so if somebody has a new technique, they share it at our meetings, and it is an honor to be asked to present your techniques at these meetings, to share that information. Like if you're any other type of physician and you found a new way to treat a patient, this is not something that you keep as a secret for yourself. So we share that information, and so if you do have a plastic surgeon or a cosmetic doctor who is advertising their own specialty tummy tuck, saying that it's better than other ones, they invented it, it's basically BS, because if we don't know about it, then it's most likely just a scam. So number one thing, there are tummy tucks, there are mini tummy tucks, there are full tummy tucks, there are circumferential tummy tucks where you take skin off both all the way around the body. These are all procedures that we all know. Where, however, there may be some discussion amongst plastic surgeons as far as what is good and what isn't good, are the techniques done in that type of tummy tuck. Okay, so for example, I just want to mention a few things here. One of the things that I do in my tummy tuck surgeries that I pride myself on is trying to keep the scar nice and low. So if you have a tummy tuck surgery, that creates a hip-to-hip scar. You also get a scar around your belly button as well. What I do is I pride myself on keeping that scar nice and low so you can hide it underneath your bathing suit or a pair of shorts. If, let's say, you're having a tummy tuck done and you're not sure that your plastic surgeon is going to try to hide that scar for you, then one thing you can do at the time of surgery is to bring a pair of underwear that you want to hide your scar under, and that way you can see where the marking is and where that scar would be. The internet is littered with before and after photos of doctors who are proud of their tummy tuck results, showing scars that go way too high up around the hip bones. Okay, and those are scars that are very, very hard to hide. So one of the things that you want to do ideally is talk with your surgeon about where that scar is going to be, and make sure that doctor keeps the scar nice and low so that if you're wearing a bathing suit or you're wearing a pair of shorts, that scar isn't sticking out. And so once again, wearing a pair of underwear to your either consultation or to the actual surgery so you can see that that scar is going to be hidden underneath that underwear is a good idea. Liposuction, what about that? A lot of doctors will combine liposuction with a tummy tuck. In general, that is a reasonable thing. When is it not good? Well, if you liposuction the actual tummy before you pull it down, that may be a bit risky. Now, this is a bit controversial. There are some plastic surgeons that believe that you can aggressively liposuction that skin and fat that is pulled down on a tummy tuck. Other surgeons, like myself, are very cautious with that because if you over liposuction that skin, you can disrupt the blood supply and that skin can literally die. And when skin dies, it turns black and it literally will fall off. No joke. And you get this hole, this crater in your tummy that can take months for it to heal. And as it scars in, it's never going to look the same. So should you do liposuction with the tummy tuck? If you liposuction the hips, that's typically considered very safe. But liposuctioning the tummy prior to pulling it down is definitely a bit controversial. And I myself rarely do that in my own patients. Some other things, okay? How about drains? The vast majority of tummy tucks done around the country on patients, if you have it done, you're going to have at least one drain afterwards. The traditional way to do it, and how I was taught, 15, 20 years ago, is that you would have two drains. One drain would extend high into the upper abdomen. The other drain would be nice and low in the lower abdomen. Those drains would stay in anywhere from 2 to 3 weeks before they're taken out. The drains are fairly good size, and even after those drains are taken out, when I did this traditional technique, I would find a 25% chance of developing a seroma, which is a late onset fluid collection. If you get a fluid collection after a tummy tuck, most often that needs to be drained, usually with a long needle. Not fun. But that is the traditional way of doing a tummy tuck. And you have two drains often that are coming out of the pubic area. So you have these two incisions, these two scars in your pubic area. Like I said, drains can stay in for a couple of weeks. Now, that's how I was trained. That's how I initially did it in my patients. And I realized, however, that there had to be a better way. Okay, this to have these two large drains with a high risk of fluid collections afterwards just did not make sense to me. So there was a plastic surgeon, a father-son combination out in Texas, the Lalonde doctors, who devised something called progressive tension sutures, and where you actually will suture the skin down. When you pull the skin down of a tummy tuck, you actually suture it in down to the muscle layer. You can also call them quilting sutures, kind of like, like if you make a quilt, or even like you make a mattress where you've got those little indents, so you can suture that down. What that allows us to do, and some surgeons don't even use any drains with it, and you can technically do a safe drainless tummy tuck. In my patients, I typically will place one little drain, and that stays in a week or less. And just as important, the risk of a seroma, a fluid collection afterwards, is probably less than 2 or 3%. So it's extremely low, okay? This is something that takes about an extra 15 minutes in the operating room to do it. And why all plastic surgeons don't do it across the country is beyond me, because it is so nice for the patients to limit those drains, to lower your risk of seromas. If your doctor is not planning to do progressive tension sutures and they're going to put 2 drains in you for 3 weeks or something, you got to ask them, why are you doing that? Is this an old-fashioned technique? Because, in my opinion, yes, it is. So look out for yourself, educate yourself. There is such a thing as a drainless tummy tuck. I usually use a drain. The reason why is just to play it safe, because we can take that drain out sometimes as early as 3 days. It's not a huge deal at that time. And what I don't want is, once again, is to develop a seroma. So either doing a drainless tummy tuck, or like I said, with me, I put one drain in, you usually leave it less than a week. Also very important, if you're having a tummy tuck surgery, is to walk afterwards. One of the most concerning complications from tummy tuck surgery is a blood clot. And blood clots happen more in tummy tuck surgeries than in any other operation that we do cosmetically. And so it is super important, if you have a tummy tuck, to walk afterwards. Even that night, you want to do some walking, move those legs around, get some circulation going. Not to exercise, okay? You don't want to be raising your blood pressure and working out, but to actually get some blood flow going through your legs to prevent those clots. Talk to your plastic surgeon and get their opinion on it, but in general, that's super important from my standpoint to prevent blood clots. I've got a few more things I'd like to cover, but if you've got questions, this is your chance to ask them of me. I'm a board-certified plastic surgeon, America's holistic plastic surgeon. Feel free to ask questions. I'm going to get to them at the end of this broadcast. What do you add to a tummy tuck? Well, a tummy tuck combined with a breast enhancing type of surgery, whether a breast lift or breast implants or the combination of both, is typically called a mommy makeover. Very popular operation. I do that all the time. Sometimes you also combine liposuction with tummy tucks. Some people combine BBL or fat grafting with tummy tucks. One big caution for you is I mentioned earlier that tummy tucks have the highest rate of blood clots, one of the highest in all of cosmetic surgery. So it's super important, ideally, to limit the amount of surgeries that you add with a tummy tuck. You ideally don't want to undergo a 8 or 10 hour tummy tuck and other surgery extravaganza. If you do, and some doctors do this, you are putting your life at risk. If you're under for that long under a general anesthetic, your risk of blood clots goes up. And if you get a blood clot after a surgery like this, there's a chance that you will die. Yes, that you could die from it, okay? And if people die after plastic surgery, most of the time, in that immediate setting, it's because of a blood clot. So in my practice, what I try to do is freaking everything that I can to prevent a blood clot. And one of the big things is limiting the length of the operation. So in my practice, I try to limit it to 6 hours or less, and even 6 hours honestly gets me a little bit nervous. There are some other surgeons that do 8 hours. I think that's getting up there. I think 10 hours is just way too long. So watch out for yourself. There are doctors out there who will operate 10 or 12 hours on you because they will make more money the longer they operate on you, okay? But that's not necessarily what's good for your health. Try to limit your surgery to 6 hours or less. Some doctors would argue 8. I think 8 hours is too long, but once again, that's my opinion. And make sure afterwards you walk. If you're going to have a lengthy operation like that, most likely you will need some type of nursing care afterwards, somebody to watch out for you. You don't want to do an 8-hour surgery and then have a cab drop you off at your apartment at home afterwards. Not a good idea. So I hope that this is good advice for you. Also, if you're having a tummy tuck, one of the worst things that can happen, nothing like a blood clot, but one of the bad things that can happen afterwards is you can get really constipated. Combining the anesthetic with pain medication, with the tightening of your abdomen, with you not moving as much as you normally would, you have a very high risk of getting constipated. So you really want to be active in trying to move your bowels. Drink a lot of liquids. Eat a lot of high fiber foods. Don't go and get fast food that's going to sit in your stomach for days, in your gut for days. Because if you get constipated after a tummy tuck, you can't wait it out. I get patients that tell me, yeah, I was feeling really constipated. I couldn't move my bowels, so I figured I'd give it another couple of days. Horrible idea. As if you're eating now and you're stopped up, you're just making that worse and worse and worse. So be proactive with your bowels. Talk to your doctor. You may want to consider something like Colace, which is a stool softener. For my patients, I recommend that they start a laxative just within a couple of days of surgery to really get their bowels moving. Usually after you move your bowels once, you're pretty darn good after that. Another thing too, tummy tucks are pretty painful operations. They have a very high satisfaction rate because holy cow, you can get a really nice improvement with them. But at the same time, you have a fairly lengthy recovery with it compared to, let's say, a breast enhancement or a blepharoplasty. One thing that I do in my patients is give them a long-acting local anesthetic. I would love to use a product called Exparel. This is a long-acting bupivacaine, which is a numbing medicine. If you inject that into the muscle that's tightened, you can get several days of pain control with it. In my hospital, they don't have that, unfortunately, on formulary, which is a huge bummer, honestly. So we use our pain pumps. So we have this basically balloon filled with numbing medicine that goes into the area where the muscle is tightened, and the patient basically carries this around for the first few days. So that's another tip. Especially if you're going to have muscle tightening, a rectus plication with your tummy tuck, ask your doctor about pain control measurements or pain control measures like Exparel or a pain pump. If they don't offer that to you, ask them why not, because that is going to make your recovery much easier. So those are some of the tummy tuck tips that I have. Continue to check out here on YouTube. We will show before and afters of tummy tuck surgeries. What we do on this YouTube page is I try to wait until we get the after, and we kind of put the whole thing up in one video. If you're interested in watching things each day as we are doing them, then feel free to check me out on my Instagram page, @TonyYounMD, where